So we're going to move right on to applying a fetal scalp electrode. So I'm going to have my assistant. We already have our sterile gloves on. I haven't touched anything that's not sterile since we did the artificial rupture of membranes. But so we're going to do the application of the fetal scalp electrode. So again, if you're doing this without having done the previous procedure that we just demonstrated, you would do all of the things that we've discussed earlier: introducing yourself, asking for pronouns, getting consent, washing your hands, and applying or donning your sterile gloves in a sterile fashion. So we've talked to our client. They have consented to this procedure, and this is also a sterile procedure. So I have an assistant who's going to hand me my fetal scalp electrode. Once I'm ready, we're going to just do a routine vaginal exam, to kind of what we did before, to do our artificial rupture of membranes. So again, providing consent to our patient. Victoria has consented. Allowing her the opportunity to withdraw her consent at any time is very important. So if she's experiencing too much pain, or this procedure is causing her discomfort, or if she just simply changes her mind, she can just tell you that and you will stop. Victoria's aware of that. So are you okay if I go ahead, Victoria?
Yes.
Okay, so you're just going to feel touch on pressure again. So having a feel, I can feel the cervix is about 6 centimeters dilated. I can feel the fontanelles and sutures on the vertex of this baby's head in the cephalic presentation. It's very important that you attach a fetal scalp electrode away from suture lines and fontanelles. So when you're guiding your fetal scalp electrode into the vagina, you're going to keep your index finger and your middle finger about 1 centimeter or 2 apart, and identify an area that you can attach your fetal scalp electrode that does not have any sutures or fontanelles present. So all you feel is bone there. So you take your fetal scalp electrode sterilely out of the package, and you can see at the end, I'll show them the end here. There it is. The end has a little rotating clip on it that you're going to attach. You're going to turn it when you go in there to attach it. You're turning it clockwise about 1/4 of a clock turn. So not quite, about 15 seconds. So same as the AROM, when you're doing an artificial rupture of membranes, you place with the guide, you place it in between your fingers. You have your fingers about 1 to 1.5 centimeters apart. You've identified an area that you can safely apply the fetal scalp electrode. You're going to turn the dial back here 1/4 of a turn, and you can feel with your index finger that it's attached well to the scalp, and then you can withdraw your guide here. Flip the wire over top of, it's stuck onto this little turning thing, and then you're going to withdraw your guide. Now you have your end. So in order to make this work, you have to plug it into the proper device on your fetal monitor, and then attach it to the leg with the appropriate connector. And then your fetal scalp electrode will now be monitoring your fetal heart rate in the same port where you would have had your ultrasound monitoring your fetal heart. The ultrasound, you can remove the one monitoring the fetal heart from here, and now you have the ultrasound monitoring, the fetal scalp electrode monitoring through this. So you don't need that one anymore. You just need that one and the uterine contraction, the tocometer. There you go. That's it. Application of fetal scalp electrode.